Herded Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Herded Health. I am Arundhati Parmar, Editor-in-Chief of MedCity News, and I have with me today John Zutter, CEO of Lantern Care. Welcome, John. So specialty care is really expensive and accounts for a large share of our overall healthcare spend. How can Lantern Care, support self-insured employers and lower their costs in this particular space?
Yeah, it's a great question. So first, what we do is we provide a specialty care platform for large self-funded employers that provides access to some of the top quality physicians and facilities for specialty care categories including surgery, cancer, and infusions at fair prices on a geographically distributed basis. So we've gone and built a proprietary network that focuses on quality first and foremost, but cost and accessibility second and third, and that allows us to impact some of the most important areas of healthcare. As you pointed out, we have a really big problem with trend, right? Healthcare trends going up by about 8% this year. Different people have different metrics, but 8% seems to be kind of down the middle of the fairway. Surgery tends to be between 20 and 25% of healthcare costs. Cancer is between 15 and 20. And infusions is another 5 to 10. So between those three categories that we focus on, it's almost 50% of the overall healthcare spend. And it's growing at about 15% a year. And so when you think about that math, the majority of healthcare inflation is actually coming from the three categories that we focus on. So providing access to these directly contracted, highly efficient contracts to these employers is a really targeted way of impacting their overall cost of care.
And what's your average savings that you can deliver to these employers?
Yeah, well, it ranges, of course, depending on the type of procedure, but last year, for example, on average, we saved $17,000 per procedure. If you were to take a common thing that we think about and provide a lot of, take a knee replacement, for example, we'll tend to save between $20,000 and $25,000 per procedure. And when you save that much on a total basis, which tends to be about 50 or 55% savings relative to commercial reimbursement rates, there's a lot of savings to go around. And so the employer can actually pass some of those savings to their workforce in the form of waived deductibles, waived co-insurance, other cash rewards, so that you can reduce that financial burden on accessibility and drive people to make better decisions as well.
Now, since you mentioned knee replacements, I have to ask, nowadays there are places where they do knee replacements as an outpatient procedure. Is that one of the ways where some of the savings comes from?
Yeah, absolutely. So site of care efficiency is an important part of the solution to healthcare overall. United put out a study a couple of years ago where they looked at 1.2 million knee replacements in the United States, and 81% were done hospital inpatient, 90% were done either hospital inpatient or hospital outpatient, and only 10 were done in an ASC setting. But most of the science would suggest that the majority can actually be done in an ASC context. And last year we did 60% of ours in an ASC context. And so that change in site of care is one of the levers, but it's not the only lever. Some things really are appropriate to be done in a hospital. So for example, if you were to take that knee replacement case where someone has comorbidities, they're overweight, they have chronic conditions, that shouldn't probably be done in an ASC. And so we want to have a network that consists of those teaching institutes for the rare and the complex, hospitals for when that's appropriate, and outpatient settings for when that's optimized. But appropriateness has to come first.
Makes sense. Now, many companies that are in your space and work with self-insured employers offer access to centers for excellence for cancer care and surgery. What is different about Lantern Care's approach?
Ours works, but more broadly, the reason ours works when historically, this is a category that's been around for about 30 years. Every carrier has a center of excellence, and they haven't always been as effective as we'd like them to be. The thing that really is different is about local access. When you're able to provide access locally versus a drive, it's about a 5x difference in utilization. Versus a flight, it's an 8x difference in utilization. But it's not only that. If you can avoid putting someone on a plane, you have a lot less costs, which means you can actually focus on lower acuity things as well. So you have a broader top of funnel, a better member experience, greater accessibility, and also better cost savings as well. So it's really that geographic distribution that's been our special sauce for differentiation.
I'm wondering if you can talk about goals as a company. What goals do you have for Lantern in next year?
I think this one's not a next year goal, but if we could make specialty healthcare events not become one of the greatest sources of bankruptcy for the American workforce by making that care affordable and accessible, that'd be a great outcome.